average patient who wants a breast lift or needs a breast lift is tissue that's descended below the crease. And one of the simple ways you can do that is to lift your breast and put a pencil. It's called the pencil test, and you put it up under your breast and then let it stay in that crease. And if you can let your hands go and that pencil stays there, then typically you are a candidate for a lift and not just a breast augmentation. For those patients that need a breast lift, they need to see their surgeon and have him examine them and see if they are a candidate for an implant or whether they're just a candidate for a breast lift. In differentiating those two people, when I see them, if it's a patient that has adequate volume, one of the things I often ask was, do you like the way your breasts look when you're in a push-up bra or a bra? And if they say yes, then more often than not, they do not need an implant. They can get by with reducing the breast a little bit by taking some tissue out, moving the nipple-areolar complex up, reshaping the breast tissue, and more often than not, those people are quite happy. If the patient is not happy with the way their breasts look in a bra, it's generally because they don't have enough volume, and therefore they need something added in order to round out the breast and shape the breasts, because their skin and subcutaneous tissues have basically lost so much volume that it's just it's very flat up at the top, and then it hangs below the crease, and of course there's nothing that they can do to manage that. So those particular patients are the candidates usually for an implant, and because they failed the pencil test, they need to have the breast lifted, they need to have some skin removed, and the nipple usually has to be placed at a higher position, and oftentimes the nipple is very stretched out and they want it smaller anyway. So we will do that as well.